Welcome to the first section in our series on Chapter 13 material, which is Nutrition During Pregnancy and Infancy. We're going to start by talking about preparing for pregnancy. And if the mother is underweight, and that's underweight going into the pregnancy, it usually means that the infant has a higher chance of being underweight when they're born. Now, when an infant is underweight when they're born, it is a very poor predictor of the infant's future health. Now, if the infant ends up being underweight, just like I said, I want you to think about it being the single most potent indicator of the infant's future health. Now, if the mother's overweight, and this is actually a more common scenario, particularly these days, then it's very common to have an infant that is typically overweight. Now, the problems associated with an infant being overweight is that they are more likely to be obese later on in life, which means they're more likely to develop type 2 diabetes. They have a greater chance of childhood obesity, and they have a greater chance of neural tube defects. Now, if the mother is overweight, and this is going into the pregnancy, she has a greater chance of being overweight during the pregnancy. She won't need to gain as much weight during the pregnancy, but also the mother has health risks too. And those are that she has a greater chance of developing hypertension, that's high blood pressure during her pregnancy, diabetes, that she'll end up with a drug-induced labor, and has a greater chance of having a C-section. Now, if the infant has a lower birth weight, so if the infant is born at a lower weight than average, that infant's going to have a chance of having a lower IQ, it's going to be shorter in stature, and is 40 times more likely to die within that first year of life. 40 times. So having a low birth weight is, just like I said, is a very strong predictor of the infant's future health, and a very important predictor because of that increased chance for mortality. Now, as I mentioned before, if the infant has a higher birth weight, they're going to be a larger size, and that's a larger size through life. They're at a greater chance of having childhood obesity, going into adulthood with obesity, and then subsequently we can say that will lead to an increased chance of type 2 diabetes later on in life. Also 2 times more likely to develop a neural tube defect. And that is the end of the first section on our preparing for pregnancy.